عليكم مرة ثلاث. Our subject today will be the ear anatomy. Objectives: we will discuss the external ear, middle ear, internal auditory meatus and its contents, and the facial nerve. External ear consists of the pinna and the external auditory meatus. The external meatus is 3.5 cm long, runs medially to eardrum, the tympanic membrane. The outer part of the canal is cartilaginous and the medial two-thirds is bony. The entire canal is lined by skin. This is CT showing with the diagram showing the external auditory meatus, the auricle, and the tympanic membrane. The middle ear. The middle ear is a slit-like cavity housed in the petrous bone. It has this boundary, the roof, the floor. It has four walls: anterior, posterior, lateral, and medial. I fixed this, but lateral and medial, not superior and inferior. Lateral and medial. Boundary is roof, ligament tympani. It is a thin plate of bone of the temporal bone. The floor is thin plate of bone separated from medially. We have the inner ear and its content with the oval window and the other content. Laterally we have the tympanic membrane, and anteriorly we have internal carotid artery, posteriorly adductus to the mastoid antrum. Middle ear cavity. It divided into three parts: epitympanium, mesotympanium, and hypotympanium, and these are air filled. A tiny spore of bone, the scotum, where the tympanic membrane is attached, is seen between the external auditory canal and the middle ear, as shown in the diagram. This is a coronal CT showing epitympanium, mesotympanium, and hypotympanium, with arrows, the green for scotum, facial nerve yellow, annulus, it is pink, and inferior border of cochlear in orange arrow. The epitympanium communicate with the mastoid air cell through a narrow posterior opening called adductus ad antrum. The content of the middle ear: we have the ossicles, malleus, incus, stapes. The malleus has a handle that is attached to the tympanic membrane and a head that articulates with the body of the incus at the encodomallear joint. The joint is orientated superiorly and projects into the epitympanic recess. The incus has long processes that articulate with the head of the stapes. The base of the stapes is firmly fixed into the oval window, and the joint between the ossicles is of synovial joint. On CT, the incus and malleus will appear as an ice cream cone. Muscles. We have two muscles in the ear. We have tensor tympani, originate from auditory tube wall and insert into the handle of malleus. Action: it damps down the vibration of tympanic membrane. Stapedius muscle will originate from the posterior wall of the middle ear and insertion into the neck of stapes. Action: it will damp down the vibration of stapes. The middle wall of the middle ear. There are three prominences: the lateral semicircular canal, third part of facial nerve, and cochlea, and it will have two windows: oval window, which lead to the vestibule, and round window to the cochlea. Both are like the tympanic membrane. It's a membrane. Contain membrane will transmit the sound vibrations. Another important part of the inner of the ear, it's the auditory tube, which is our eustachian tube. It represents the communication between the middle ear and the nasopharynx. It is bony at first, then cartilaginous in its lower portion. The function of the eustachian tube is open to equalize the pressure on both sides of eardrum. Normally, it is closed. A clinical point, throat infection can spread to the ear through this route. This is video showing the eustachian tube. Nasopharynx. Important pathological points. Cholesteatoma, it's typically begin in the prosac space in the epitympanium before extending and invade the surrounding structures. Infection may erode directly through the thin tegment tympani to the middle cranial fossa or can spread from the middle ear to the sigmoid sinus and cerebellum posterior cranial fossa through the mastoid air cell. Inner ear. It is a membranous system of fluid-filled sacs concerned with hearing and balance. It is housed in the protective labyrinth of dense bone and lies in the petrous bone. It consists of two parts. Bony labyrinth outer, it includes the semicircular canals, vestibule, cochlea, and sac. The membranous labyrinth, the inner part, composed of the auricle, saccule, semicircular duct, and cochlear duct, endolymphatic duct. These two diagrams show the outer and the inner portion of the bony and membranous part of the inner ear. Inner ear has the vestibule aqueduct passes from the vestibule to open in the posterior fossa midway between the internal auditory meatus and the groove for the jugular vein. The cochlear aqueduct extends from the cochlea to a slit-like opening in the posterior fossa inferior and parallel to the internal auditory meatus, as shown in the diagram. This is a CT scan coronal and axial section showing the oval window, cochlea, internal auditory canal, semi-singular canal, vestibule, vestibular aqueduct, posterior semicircular canal, and cochlea. Another CT with the color that the red one show that it's the internal auditory canal, the purple is the cochlea, vestibule in yellow, lateral semicircular canal in green, and vestibular aqueduct in orange color. Another CT in the above picture, we can show the difference between an enlarged vestibular aqueduct and normal vestibular aqueduct. Another video. We show the semicircular canal. Multi-slice CT. The bony covering of the lateral semicircular canal bulge into the middle wall of the middle ear cavity, while the superior semicircular canal forms the arcuate eminence on the superior aspect of the petrous bone. which is shown in the picture in the red color. Internal auditory meatus. It is a bony canal. It's about 1 centimeter long, transmits the seventh, eighth cranial nerve from the posterior cranial fossa. The posterior lip of the medial end of the internal auditory meatus is called the porus acousticus. A crest on this bone, the crista falciformis, divides the canal into upper and lower compartments. The upper compartments contain the facial nerve and superior vestibular branch of the eighth cranial nerve. The lower compartment contains the acoustic, cochlear, and inferior vestibular branch of the eighth cranial nerve. This cross section shows the internal auditory canal or acoustic canal, showing the branches of the facial nerve, cochlear nerve, inferior and superior vestibular nerve, and the crista falciform that divide the canal. Facial nerve. Facial nerve has four parts in relation to the ear. First part, meatal, runs in the internal auditory meatus. Second part, Libernithian, run anteriorly in its bony canal, then curves laterally and posteriorly around the cochlear to the anterior part of medial wall of the middle ear cavity. This U-band around the cochlea is known as the genu of the nerve. Third part, tympanic. It causes prominence on the medial wall of the cavity, between the prominence of the lateral semicircular canal and the promontory. Fourth part, or mastoid, emerges through the stylomastoid foramen. This is a nice diagram showing the facial nerve on its part and divisions, which can give nerve to the stapedius muscle and chorda tympani, which supply carry innervation from the tongue and parasympathetic innervation to the sublingual and submandibular canal. This is facial nerve canal axial MPR multi-planar reformation CT scan. Show the gingulate ganglion number 1, Limernithian segment number 2, and the tympanic segment 3 of the facial nerve. Radiology. A plain film. The internal acoustic meatai and parts of the bony labyrinth of the inner ear may be identified on the straight occipitofrontal skull projection, as shown in this picture. Semicircular canals, internal auditory meatus, and the vestibule. CT. Image may be obtained in both axial and coronal planes. The internal auditory meatai are rarely assist an extent of any pathology and its relationship to other important intracranial structures may be determined. High-resolution scanning of the temporal bone can image the cochlea, vestibule, semicircular canal, ossicles, and bony canal of the facial nerve in axial or coronal planes. This CT scan of inner ear, A axial section at mid-cochlear level, B coronal section in vestibular plane, showing the cochlear stern, internal auditory meatus, 3 vestibules, 4 posterior semicircular canal, 5 facial nerve, it is bony canal, malleus, incus, epitympanic recess, mastoid air cell, middle cranial fossa and posterior cranial fossa, lumboid suture, superior semicircular canal, lateral semicircular canal, oval window, crista falciform and scotum, external auditory meatus, mastoid antrum and aditus ad antrum. Number 20. MRI may also be used to study the content of the temporal bone. Coronal images demonstrate the content of the internal auditory canal to advantage, showing the facial and cochlear nerves separated by the signal void caused by the falciform crest. The cochlea and vestibule may also be identified. These are fluid-filled and of high signal intensity, and thus easier to see on T2 weighted image. As seen here, A and C axial T2 MRI to show the internal auditory meatus and its contained nerves. C membranous labyrinth as seen on 3D MRI. As we see, cochlea, vestibulocochlear nerve, and 3 facial nerve, basal artery with the flow artifact, cerebellopontine angle of cistern. And we have a quiz.
اكو احد عنده سؤال قبل ما نروح على الكويز؟ ماكو. يلا نروح على دكتور احمد مطر. الو تفضل احمد.
نعم.
اي
دكتور هذا اي كوكليا عمي.
هذا الكوكليا.
نعم.
دكتورة إسراء بي. دكتورة إسراء.
دكتورة إسراء ثامر أو إسراء عبد الوهاب؟
إسراء عبد الوهاب.
vestibulocochlear nerve. نعم أستاذ.
مل. ووراها إسراء الثانية. سي. إسراء الثانية وينها؟ فرح عبد الله.
نعم دكتور. سي رايت فيستيبيول.
فيستيبيول. اوكي. فرح.
نعم دكتور.
بسيط هذا.
دكتور أنا دكتورة إسراء.
إسراء هذا الدي شنو؟
هذا الأوديتري انترنال كانال دكتور.
internal auditory canal. صحيح. هذا الإي بقى أخير واحد. فرح ويانا.
نعم دكتور. mastoid air cells.
mastoid air cells. excellent.
بس ال A وال B هم رايت مالس and incus مو vestibulo.
اي الرايت ميلاس اند انكس صحيح. لانه الايس كريم تفضل استاذ محمد.
شكرا استاذ رعد. فاطمه هيكل.
نعم. ال A هي ال left Eustachian tube.
نعم. ضحى محمد بي. ضحى محمد ويانا. سارة توفيق.
نعم
سارة
أستاذ
توفيق.
left oval window. نعم أستاذ left oval window.
تمام. زينب رافد. زينب رافد. زينب ويانا. حسين علي محمد.
نعم أستاذ. سي
سي.
right editus of antron.
أزهر الشاع دي.
تمباني كريسس رايت.
نعم. وآخر وحدة حوري قاسم.
نعم دكتور. دي هو رايت بتراس
الإي. الإي.
نعم الإي.
حرف إي.
رايت
نعم.
بتراس تمبرال بون.
نعم.
عايشة ايدك